Welcome back to Good Day, and thanks for waking up with us this morning. I'm Scarlett Grayson. St. David's North Austin Medical Center recently became the first facility in Texas to use the AvaSure telesitter monitor system to monitor patients via video. Here with us today is James Pittman, the Associate Chief Nursing Officer at St. David's North Austin Medical Center. Thank you so much for joining us today.
Thank you, Scarlett. Appreciate being here.
Yeah, so this is a pretty cool system. It's a video system that monitors patients inside the hospital rooms, right? Can you tell us a little bit about what it is used for and why it's important to have?
Certainly. So we have a need to monitor patients from time to time that are at risk for falling, at risk for getting out of bed unassisted, and really because of maybe their mental state aren't aware of the dangers in which they might face trying to get up by themselves. Falls in a hospital, it's a national problem. Every hospital is working to prevent falls, and this strategy helps us by doing that, by extending the eyes and ears of our staff members so that we have a constant presence in those rooms with patients that are at risk for falling.
Absolutely. You were telling me that before this video system, they had nurses or sitters, what you called them, in the hospitals. And you can just tell us a little bit about how this video system is kind of a step up from those sitters.
Certainly. So kind of traditionally, we've used sitters, so an individual to sit in a room with the patient and monitor that patient. Obviously, that's very resource intensive when you're doing that 24 hours a day around the clock. This system allows the deployment of multiple cameras that are positioned in the room. They're mobile, they're wireless, they transmit a signal, they have a 360-degree camera, they're able to see in the dark, and it really is a surrogate, so to speak, for that individual sitter. Those patients that are being monitored are monitored by an individual that's trained and has the ability to communicate back and forth with those individual patients and help assist them or guide them, direct them to stay in bed or hold on for help. So if a patient's trying to get out of bed on their own and they're not really aware of what's going on, we can redirect them. The technology allows us to communicate in multiple languages with pre-recorded messages. And it also, while we're redirecting, we can simultaneously contact the nursing unit, the nurses on the unit, and sound an alarm to let people know to come into the room and help the patient.
Okay, and so if we haven't been showing you pictures of this system, we have it here. You can see a little bit about it right now. There it is. That's the telesitter. So does that move around? You're saying that can it talk? Does a voice come out of it? Is that how it redirects them? Tell us a little bit about that.
Right. So the camera is mobile and it's placed into the patient's room, obviously with the patient's family members' consent, and it's been really a kind of an alleviator of fear for many of our patients' family members, because of now they know that there's this constant presence that's monitoring their loved one, so that they're not at risk for injuries due to falls. And so through that we can talk to them. There's a box that has a speaker, a two-way communication system, and so they can call out for help and we can respond to them.
Okay, very cool. Now the one thing is let's talk about maybe some of the concerns. So reading about it a little bit, would people be concerned about the fact that a sitter's not actually in the room? So what about that immediate help that patient might need? How does that kind of fit in?
So certainly, a lot of the times individuals who are in need of a solution such as this are, because of maybe their situation, they're not as spry as you might think, and so they're not just going to pop right out of bed. It's kind of there's a period in time in which we can see, as they become agitated or there's increased movement, we can alert an individual, because oftentimes there's really no real kind of attempt, and so we assess all of our patients to ensure that this strategy is right for them and it's done continuously. In the event that a patient is maybe too active or just not appropriate for the solution, then we're able to go back and deploy a traditional sitter type model. The great thing about this is that in healthcare there's a finite amount of resources that we have with regard to really anything that you think about, right? And so this and Dr. Jane McCurley is our CNO, and she's just the one who really just has initiated this whole thing, as she's been challenged in finding innovative ideas and ways in which we can use technology to the best of our abilities to help allocate those resources that we need in other areas.
Well, I really appreciate you coming on the show today. That is the time that we have right now, but if you do want to check out more about this system, if you want to learn more about the technology, you can obviously visit St. David's North Austin Medical Center's website. They'll have it there and tell you a little bit more about it, right?
That's right.
All right. Well, thank you so much for joining us this morning.
I appreciate it. Thank you.